So you had a successful phone interview and you're ready to meet with the practice. That's great, but there are a few things you should do to prepare. First, you should prepare your references. So find a former employer, a current coworker, maybe a specialist you work closely with, or if you're in dental school or residency, find faculty or advisor that wouldn't mind talking about your clinical abilities and what it's like to work with you and to speak to your professionalism. Second, research the practice. Look up the owner's website, read about him or her, read about the staff, read about how they interact with patients, read about the type of procedures they're offering, and more importantly, read about how they're positioning themselves in the marketplace. You can learn a lot from finding out how a practice likes to think of themselves and likes to describe them to their potential patients. Third, prepare your production numbers. If you're an experienced dentist, it should be no problem to provide production numbers for your average day or week or month or whatever time frame you prefer. You should also be able to talk about the average fees of the practice you're in, and that should allow the owner to make a fair comparison over that practice versus his or her own. If you're less experienced, say coming out of dental school or residency, then you probably don't have access to production numbers, at least not in most cases. And so what you may consider doing instead is providing a total list of number of procedures done from different specialties. For instance, how many root canals have you done, how many crowns, how many extractions. Also, you may consider timing yourself doing certain procedures. For instance, how long does it take you to do a crown prep? How long does it take you to do a root canal? These things will be helpful and help to demonstrate how you may be a better fit and may be able to quicker ramp up into the position compared to someone else at a similar level of experience. Since you are looking to advance your career, it is just as important for you to interview the potential employer as it is for them to interview you. With this in mind, it's important to go into the interview with some questions prepared. This will help to show your interest in the position. It will also provide you the information you need in order to make a good, informed, long-term decision about when it finally comes time to accept an offer. And then also it'll help to take some of the pressure off the interviewer. Here are a few questions you might consider. What is your treatment philosophy? Are you conservative? Are you aggressive? What would be expected of me as an employee, and what role would I be expected to fill? Would I be limited to certain types of cases or procedures, such as endo or pediatrics, or checking hygiene? Tell me about your patient base. Are there families, geriatric, pediatric, etc.? What demographic changes have occurred in your practice in the last 10 years, and what changes are on the horizon? Do you actively market, or do you depend on referrals? What kind of equipment do you use? What about your practice are you most proud of? Where do you see the practice in 5 to 10 years? What are your personal and professional goals? What are your goals for the practice? Are you referring out a lot of a certain type of procedure? What specific things are you looking for in the new associate, and what do you want them to bring to the practice? You can find more questions listed on our website. We hope this is giving you the insight you need in order to interview confidently. Good luck!